planning to be in the hospital, what general advice can I give you as a nurse? In the perfect world, your discharge team would have it all planned and line up. However, sometimes things happen. Sometimes, I don't know, people get discharged sooner. People get discharged before the weekend because they need to clear up some space. And if you are stable, if your condition is stable, they may make a decision to discharge you a little sooner than you were expecting, or whatever. Normally, the discharge should be pre-planned before the surgery. They should give you some heads ups. Let's say, okay, we're gonna wait for you. Let's say if it's a colon surgery, we're gonna wait for you to have your first bowel movement in the hospital, and then to make sure it went right, like all went okay. We see that your system works well, and then we can discharge. Sometimes it can go not as planned. And let's say you are all stable and with the auscultation, it can be proven that your colon works, like there is a peristaltic which can be auscultated. So you are stable, everything is fine. You may be discharged sooner than you were expecting. So you need to be prepared. The same advice as after the minor surgery, right? What had been done, like hopefully it will be discussed with you before the discharge. Before I start going about the discharge, I would advise when you go to a hospital for any extended stay, let's say if it's not in and out, but even if it's in and out, I always advise people to have a private caregiver with them in the hospital. A caregiver doesn't have to be a nurse. It can be working under the nursing supervision, but somebody private, or maybe a family member if you have enough family members who could spare some time with you in the hospital. It's always great to have a private person with you in the hospital. Why? Because when you are in the hospital, unless you're not really well at all, like you sometimes would not want to ring the bell to bring them a blanket, to bring you a blanket. You will be, well, nurses are busy. I don't really want to feel like I'm nagging them or whatever, like asking too many questions, but having somebody with you who would execute those tasks is really helpful. Somebody who would go warm up a blanket for you in the warmer, bring you some ice cubes, help you with lunch, help you with I don't know, go downstairs, get you a coffee, whatever. It is always helpful to have an extra pair of hands when you are in the hospital, especially for a long time, for like an extended period of time. If it's not possible, then maybe just have somebody visiting you a couple of times a day. It's great to have, hospitals are not fun. As much as they help us, it's not fun to be in, and it's always good to have somebody with you. Okay, so imagine everything went well. The hospital is ready to discharge you. You were given some guidelines what will happen before the discharge. In the perfect case scenario, it all went as planned. Sometimes it's not, and you're discharged sooner. For example, you're being discharged already. They will discharge you once they know what plan you have to be at home. If you live by yourself and you are 95 years old, you have no caregiver, you have no family member, they should not discharge you just like in the middle of nowhere. The discharge team should arrange some kind of health authority people coming and checking on you. And again, would it fulfill all your needs? Not clear, depends on your needs. If you can get a private person for at least the period of recovery, that's great. The discharge plan, right? Again, what kind of expectation are normal? Let's say if you had a colon surgery, most likely you will pass some blood during your first bowel movement. A little bit of blood may be okay. If it's too much of blood, it will not be okay. How much is okay, how much is not? And again, I'm just brainstorming, giving you general advice for your specific surgery. Ask your medical team what exactly was done and how much of our unexpected things will be all right. If it's the fresh blood, yes, we can assume that it's probably just because it was cut and freshly, I don't know, stayed there. But if like there is also bleeding, internal bleeding, and the signs could be different. In general, again, those ABCs, which we always talk about, A, if it's something wrong with the airways, B, if it's your breathing pattern that changed, and C, the circulation. If you have an internal bleeding, this is not an advice on the internal bleeding, but most likely your blood pressure will drop. Their blood you pass through colon could be like coffee-like, or like old bloods, or a lot of fresh blood. Again, talk to your medical team about your specific expectations. But it will be great if somebody could check your vitals to make sure that you are stable, keep this data to see if everything is stable. The temperature, like, do you have a high fever or a little subfebrile, like 37.1? Because that is, again, a normal expectation after the surgery to have a slight temperature for a couple of days. But if it is a high temperature, maybe if it's a fever, right? High fever, maybe you have an infection going on. The signs of infection could be pain, discharge, redness on the incision. So all those things should be monitored. That's why it's advisable to have a care attendant or a nurse or private nurse or from health authority, whatever. Depends where you live, depends on your capabilities, on your resources. If you are able to get a private team, it's always advisable, because those signs of infection, of any complication, should be monitored, and you will not be in the position, most likely after the surgery, you're not feeling great, you don't have enough strength, you have pain. Some pain is expected, but how much should you tolerate pain? If your pain tolerance is very, very high, is it okay to go to the level of 7 out of 10? No, it is not. It's advisable to keep it below 4. You shouldn't start taking pain medication when your pain is already 5 out of 10, because by the time you've taken this medication and it starts working, your pain will go to 7. High pain is not good during the post-surgery recovery, because as more pain we have, as more tissues are swollen, it can cause other complications. So all those things should be clarified with the discharge team, with your leading medical professional, and monitored after the surgery. Can the family member do it? Family members have their own, first of all, they may not have enough training and understanding in this area. And also they have their own life duties, which sometimes, often, cannot be put aside for your recovery, right? So it is advisable to pre-plan your hospital trip, to make sure you have somebody in the hospital with you and after the hospital for the recovery period. For how long, I cannot say. I advise people to it's better to over prepare than under prepare, maybe from 2 to 6 weeks, and depends on the involvement. Clarify when should you, and if you should, go to the emergency. And if it's not an emergency, do you have a phone number of your medical doctor? Do you have enough pain medication for the recovery period? It will happen when these medications are finished. What can you take, or can you get a refill? Another thing, something after the surgery is quite common. If you had a urinal catheter during the surgery or after the surgery, anytime something enters our body, it opens a source of infection. Every time we have a catheter, we have a chance for the UTI. UTI is a urinary tract infection. Not necessarily, but as I said, every time something enters our body, we can have a complication. Painful urination, increased frequency of urination, urge to urinate but not enough urine, not able to completely empty your bladder. Confusion could be a sign of urinary tract infection, even if there is no frequency in urination changed. Confusion, which could be cleared once the source of infection is gone. And sometimes blood in urine could be a sign of infection, of urinary tract infection. Again, there is so much more to the post-op complication. And as I said, the discharge is not always as planned. In the very ideal world, the hospital should never discharge you before your system start working. Let's say if you have a catheter and then the catheter was taken out, you have to be able to urinate without the catheter the first time when you're still in the hospital. Because what happens sometimes when the catheter is being removed, the person thinks that they will be able to go and void themselves independently, but they are not. It could be like I don't know, whatever. It's a psychological but also physiological. The sphincter closes off, and there is a fear, there's pain to urinate without the catheter. So normally in the ideal world, before you've been discharged, if you had a catheter, you have to be able to urinate without the catheter when you're still in the hospital. Because if you are not able to urinate and your bladder is full, and let's say you had a colon surgery and your full bladder is present on the colon, oh my goodness, you're going to be in so much pain, right? So things like that should be looked at when you're still in the hospital. If you have any questions, please feel free to go on my website, and on the very bottom there is a form, Ask a Nurse. Shoot your question there, and once a month I have Q&A sessions. I can help you stay healthy, pre-plan, have a professional with you by your side, and always over-prepare. It will serve you in the long run. Have a healthy day.